Hey guys, welcome to Methods Take 2 for my research project, which is looking at the effects of deep oscillation therapy on H-reflex and the static lunge test or range of motion in the ankle. So this will specifically look at the H-reflex of the soleus. So no longer is my project related mainly to prevention of injuries to the Achilles tendon like it was before, but now we're looking to dig deeper into what deep oscillation therapy actually does. So this is more of a foundational research study. Our design is going to be a single cohort, repeated measures. So what that means is the patient will come in, obviously consent and health history, inclusion, exclusion. Those kind of issues will be worked out. And then we will take their H-reflex measurement, and then we will give them a deep oscillation therapy treatment through the HivaMat 200. And then they will do an H-reflex again. So that treatment is day one. Day two will be, they will come in, we will do a static lunge test, determine their range of motion, specifically, obviously, dorsiflexion. They will get a HivaMat treatment, and we will do that measurement again. This will be a few days, anywhere from 24 to 72 hours after their initial session. And so that session will be much shorter because the static lunge doesn't take quite as long for the H-reflex measurement. So with that, when it comes to the H-reflex, that does take a little time. Dr. Games is our point person on that. He's actually completed a study with an H-reflex measurement before, and so we're really relying on him on setup and how to specifically execute H-reflex of the soleus, which seems to be a bit complicated as I read, but I'm very interested in continuing to learn. We're in the works and doing reliability type things, and reliability learning on the H-reflex and the actual procedures. So not quite there yet for that. The static lunge, however, Dr. Powden has helped us in just teaching us how exactly he's measured it in the past. There is some variability with how the heel comes up and what you measure, whether it's just a little bit or actual gapping. So he's helped a lot with that, and me and Riley have done some reliability with that. Okay, so like I said, this is very foundational research. We're looking at how deep oscillation therapy affects range of motion, essentially. So we know that it increases range of motion. We know that it creates more positive pain, so less pain in the area. We know it helps with edema. So how is it doing this? How is it increasing range of motion? We don't know if it's lymphatic or nerve related. So that is why we're kind of comparing the two, looking at both nerve and a more functional range of motion test. With that, I really was interested in having that clinical application, having that functional test, so that a clinician can still look at this project and take something away from it. Not everybody can measure H-reflex, but they can see that in the static lunge test. So that was really important. But also we want to know, are the nerves changing? Most of the foundational research comes from the manufacturer, so there's not a lot that look more in depth like we are going to look. So I'm really excited to kind of place that first brick, and a really substantial one. Moving forward, so like I said, single cohort, repeated measures. We don't have a sham treatment. We don't have a control group, so we're only going to need about 20 patients. Those patients are going to be 18 and older, and specifically active. So obviously our convenient sample will come into place here, people that are willing to participate, and we don't really know what that looks like yet. Haven't gotten to recruiting and what recruiting is going to look like. But I assume, the people in our department or specifically on campus will be most likely, but we're really hoping to reach out to people in the community as well to get some participants. I don't see 20 people being much of a problem. That seems pretty doable, but you just never know. My independent variable is the HIVAMAT treatment itself. So I'm going to show you a little sheet. It's maybe hard to read for you guys, but this just kind of goes through all the possible treatments for HIVAMAT. And I'm going to walk you through one really fast. So on this list, it gives you a number of different injuries, such as carpal tunnel, tendonitis, inflammation, anything you could possibly think, and their protocol for it. So the protocol that we are leaning towards, and most likely will do, is for a contracture. Basically, we really liked the ranges and the 3 steps. Some of them have, one-step treatment. Some of them have 2-step treatments. This one has 3. So, but before every treatment, before the actual protocol, our beginning protocol will be a substernal 1-minute treatment, and then we'll do a groin 1-minute treatment, and behind the knee 1 minute. After that, we'll spend 11 minutes on the calf, so it will be 4 minutes of 120 frequency, and then it will be 3 minutes of 85 frequency, and then another 4 minutes of 20 megahertz frequency. So that after that 11 minutes, we'll do 1 more minute of the treatment behind the knee, and I believe that those individual 1 minutes will be at 25. So it just kind of stimulates to move the fluid out. I believe it's more related to like a lymphatic, so it's over different lymphatic junctions that we'll use. After that, we'll measure again. So that is the main treatment. Our dependent variables are the H reflex and the static lunge test. So, we described those a little earlier. As for some questions that some of my classmates have, Sean asked if there would be any apprehension with the subjects with H reflex. I don't anticipate it's very uncomfortable. I've not personally felt it yet, and I hope to before we put this on other patients. But I don't see that being an issue, and I'm hoping any questions they might have we'll be able to answer and address. And he also asked about the focus of our subjects. Mainly, I think our focus is just collecting patients, 18 and older, obviously for consent reasons, but just active, and somebody who is participating in activity weekly, because that is kind of what HIVAMAT is used the most on for athletes, and we want to be able to take from this project that, if you had a patient that needed range of motion help, they didn't necessarily have an injury, but needed increased range of motion in their calf, does our study tell us that treatment of HIVAMAT is the way to do that? So please, if you have any questions, let me know. Thanks.